How might you tell something's not exactly right? Focus on the pieces of information from your body. Play it shrewd when you notice whatever might be a serious medical issue, similar to malignant growth. Converse with your primary care physician and have it looked at. As a general rule, illness is simpler to treat when you spot it early. Signals of cancer in men and women: hunger, misfortune. Many circumstances, from gloom to the season's virus, can cause you to feel less eager. Malignant growth can have this impact by changing your digestion, the manner in which your body transforms food into energy. Stomach, pancreatic, colon, and ovarian malignant growths likewise can come down on your stomach and cause you to feel to fold, even consider eating. Blood in the stool. Malignant growths can drain, yet so can a lot of different things, similar to ulcers, hemorrhoids, contaminations, or a sore. At the point when you see red in your crap, the blood is frequently from some place in your GI plot, meaning your throat, stomach, or digestion tracts. How light or dark the blood appears can be one way to determine its origin. Dazzling red could mean the draining is in your rectum or the finish of your digestion tracts. A hazier variety implies it could be from higher up, similar to a stomach ulcer. The stool is more obscure in light of the fact that it's been presented to stomach corrosive. Regardless of what the reason, blood in your stool should be looked at. You might require a colonoscopy or different tests to track down the issue. Blood in the pee. At the point when it appears in your pee, blood could be an admonition indication of an issue in your urinary plot. Kidney or bladder malignant growth can cause this side effect. Yet it could likewise be because of a contamination, kidney stones, or kidney infection. That doesn't disappear. Along with other warning signs like chest pain, weight loss, hoarseness, fatigue, and shortness of breath, a cold or the flu can make you hack away. However, it is also a potential symptom of lung cancer. If you can't seem to get rid of it, see a doctor, especially if you smoke. Extreme exhaustion. It's one of the most well-known malignant growth side effects. We're not discussing a typical sort of sleepiness here. Fatigue doesn't disappear. Consult your doctor if increasing your activity level or getting more sleep doesn't make you feel better. Fever that doesn't disappear. When your temperature rises, it typically indicates that you have an infection. However, a few tumors, including lymphoma, leukemia, and kidney and liver malignant growths, can likewise get that going. Disease fevers frequently rise and fall during the day, and once in a while they top simultaneously. See your PCP. Assuming you have a temperature of over 100.5 degrees F that goes on for an excess of a couple of days. Not in the neck. It could be an infection, but it could also be a sign of thyroid cancer in its early stages. Malignant growth irregularities, for the most part, don't do any harm. On the off chance that you have one that doesn't disappear or develops, see your PCP. Night sweats in moderately aged ladies. It very well may be a side effect of menopause. But on the other hand, it's a side effect of disease or a contamination. Skin changes. An indication of skin disease is a development that begins to appear to be unique or an irritated that doesn't recuperate. See a dermatologist for any spot that gets greater or thicker, changes tone, has a strangely molded line, is greater than a pencil eraser. Enlarged lymph hubs. Strep throat or another infection is most likely the cause of the lumps on the side of your neck. Cancers like lymphoma and leukemia can occasionally cause the lymph nodes to swell. Bosom disease that has spread can cause enlarging in lymph hubs under the arms. In the event that the enlarging doesn't disappear, in a week or somewhere in the vicinity, have your primary care physician investigate. Difficulty swallowing. An inclination like there's a sense of foreboding deep in your soul is a typical side effect of acid reflux. It may indicate esophageal cancer if you find it difficult to swallow, which happens less often. In the event that the inclination doesn't ease up or it deteriorates, see your primary care physician. Shed pounds without hardly lifting a finger. Upwards of 2 of 5 individuals who are determined to have malignant growth have shed pounds. There's no undeniable reason. Have any unexplained weight reduction looked at? Malignant growth side effects in men: blood in pee or semen. A pink, brown, or red hint to your pee or semen is generally nothing to overreact over. Bleeding can be caused by infections, kidney stones, injuries, and non-cancerous prostate growth. Once in a while, bladder or prostate malignant growth may be to be faulted. Your PCP can do pee tests and different tests to track down the wellspring of the blood. Protuberance in the gonad. Having one that doesn't hurt is a possible sign of testicular cancer. However, the bump could also be the result of a hernia, fluid buildup, or an injury. It's difficult to tell the reason from your side effects alone, so go to your PCP for a test. Torment during discharge or pee. Assuming it harms when you pee or have a climax, you might have a disease or expanding of your prostate organ or urethra. There is a possibility that prostate cancer is the cause of these symptoms. On the off chance that the torment gets worse, have your primary care physician investigate. Disease side effects in ladies' bosom: protuberance or change. Despite the fact that it's a trademark side effect of bosom disease, most bumps aren't malignant growth. They're many times liquid-filled sores or non-cancerous cancers. All things considered, see your PCP immediately, assuming that you see as any new or changing developments in your bosoms, just to ensure. Likewise, have these progressions looked at: scaling or redness of the breast skin, bosom torment, areola. Changes, protuberance under your arm. But that isn't bosom milk spilling from the areola draining between periods or after menopause. During women's reproductive years, their period is typically their monthly bleeding from the vagina. At the point when it occurs after menopause or beyond typical periods, cervical or endometrial malignant growth is plausible. Call your primary care physician, assuming you have any draining that is uncommon for you.